Now moving on to some of the other causes of the hand injuries, especially associated with trauma of the cold and as well as the burns. That is the burn and frostbite trauma of the hand. We'll be discussing the flame and fluid burns, electric and chemical burns, and injection injuries and frostbite as well. Superficial burns usually are covered with moist, non-adherent dressings, and they're usually one which are although very painful, there may be associated a lot of blister formation. But the good part is when the superficial skin is damaged, and there's usually not much of a nuisance. Hand is elevated and finger movements are encouraged, although NSAIDs has to be given as well so that the patient is pain-free. If it's a partial thickness burns, they are usually allowed to heal spontaneously because still although scar formation will take place, but they can heal. Hand dressed with antimicrobial cream and splinted, and once the healing process starts, we can start the range of motion and physiotherapy of the hand as well. But if it's involving a full thickness burn, that is involving all the layers of the superficial and deep fascia, then they do not heal as well. And this devitalized tissue has to be excised, necrotic tissue has to be removed and debrided, and sometimes the compartment becomes so tight due to edema, there is always the risk of compartment syndrome. Therefore, eschorotomy may be required as well, especially in the case of full thickness burn. But when we are dealing with the full thickness burn, we have to make it sure the patient's fluid requirements are actually met as well, depending on the percentage of body surface burn which patient had. Now coming to the electric burn, although on appearance they do not appear to be very problematic, but they are actually very notorious. May cause damage and thrombosis. Why? Because actually once they are going through, the electric current actually passes through the nerve. This causes the arteries. This actually causes coagulative necrosis of the nerves and arteries, which causes thrombosis and eventually causes ischemia. This also causes the rhabdomyolysis, or the breakdown of the muscle myoglobin, which actually results in kidney failure as well. So even if so superficial appearance, this kind of injury which looks very trivial, this could be very devastating and may result in a very severe form of a hand or a forearm compartment syndrome. So it is very important to look for. Patient may need resuscitation initially. Why? Because when the current passes through the body, there could be acute attack of fibrillation or tachycardic or tachyarrhythmias which need to be looked out. Similarly, there could be lysis of the cell, there could be hyperkalemia associated problems, there could be linear shutdown due to rhabdomyolysis, and that also needs to be taken care of as per ATLS protocols. If arm, we need to monitor it because there will be massive swelling as the myoglobin breaks down, and there is always a very high chance of formation of compartment syndrome. Fasciotomy with debridement of the dead tissue is always needed. Irrigated for 20 to 30 minutes with water or saline, sometimes with a specific reagent. Calcium gluconate for hydrogen fluoride burns. If you know what is the reagent, then you can apply that. But for not always the reagent is very clearly visible, or the patient knows what kind of reagent is being burned with. So the best method is just to go for copious quantity of water or even normal saline. And lukewarm water is sometimes more than enough. And first, above all, you have to remove the clothes of the patient which have actually been soiled with the chemicals as well, because they will continue to create more and more chemical burns. So that has to be stopped as well. Soda lime or magnesium solution for hydrochloric acid. If we know it's hydrochloric acid burn, then we can use that. And if we know there is a sodium associated burn, then we can go for mineral oil as well. Now coming to the injection injuries. Oil, grease, etc. can get injected under pressure, especially with the workers who are working in automobile industries. This can be very damaging because when that pressure, usually the chemical percolates deeper and deeper into the tissues, and this can be problematic. Although on the surface there could be very small injury, or it could be trivial percutaneous injury as well. Thumb or index finger is usually involved. Substance may gain entry through the intact skin. Air or lead paint may be shown on the X-ray if it is possible. The important point is immediate decompression. Why? Because this will not only cause severe synovitis and initiate an irritant reaction, but may also cause edema and eventually lead to compartment syndrome. And if possible, all the foreign substance has to be removed as early as possible. Now coming briefly to the frostbite. Frostbite is although a rare condition, but it's usually associated with the patients who already have a compromised vascular supply of the hand, especially if the patients having Burgess disease or vasculitis of the different vessels that may be resulting in a frostbite. If the patient comes with a frostbite and chilblains, then the option is first is to go for a limb is rewarmed in water for 40 to 40 degrees Celsius for 30 minutes. If edema can be minimized by elevation. If blisters are present, they can be drained, and digits sometimes need to be amputated. If the ischemia has progressed to a point that digit cannot be salvaged, then we have to probably go for early amputation so that this ischemia does not progresses, and eventually a whole hand amputation may not be needed as well. In this section, we have briefly gone through what are the different other injuries which can occur to the hand. For example, it could be frostbite, it could be burns, which could be superficial, partial, and deep thickness burn as well. Depending upon the problems which are associated with the burns, is that the greater the depth of the burn, the greater the problem would be, and increased chances of compartment syndrome, and we may require early surgery in that cases as well. Electric shocks, although on the surface look very simple, but are very notorious, especially because they cause coagulative necrosis, thrombosis, as well as rhabdomyolysis of the muscles, and may be very damaging, leading to some kind of ventricular tachycardias, as well as renal failure, or even the compartment syndrome which may occur along with that. Thank you very much. Keep watching sqadia.com.